Hi, my name is Bicipital Tendinitis, matrix number D2020109296. In this video, I will talk about the cryokinetic technique for the unilateral bicep tendinitis. So, what is bicep tendinitis? Bicep tendinitis is inflammation and irritation of the long head of the bicep tendon. In its early stage, the tendon becomes inflamed and swollen. As tendinitis develops, the tendon sheath can thicken. The tendon itself often thickens or grows larger. Pain in the front of the shoulder and weakness are common symptoms of bicep tendinitis. They can often be relieved with rest and medication. And in most cases, damage to the bicep tendon is due to a lifetime of normal activities. As we age, everyday wear and tear causes our tendons to slowly weaken. This degeneration can be worsened by overuse, for example, repeating the same shoulder motion again and again. Many jobs and routine chores can cause overuse damage. Sports, particularly those that require repetitive overhead motion, such as swimming, tennis, and baseball, can also put people at risk for bicep tendinitis. Move on to the functional anatomy of bicep tendinitis. The long head of the biceps tendon rises from the supraglenoid tubercle and the superior glenoid labrum. The proximal portion of the long head of the biceps tendon is extrasynovial but intra-articular. The tendon travels obliquely inside the shoulder joint, across the humeral head anteriorly, and exits the joint within the bicipital groove of the humeral head beneath the transverse humeral ligament. The bicipital groove is defined by the greater tuberosity or lateral and the lesser tuberosity or medial. The bicep tendon is contained in the rotator interval, a triangular area between the subscapularis and supraspinatus tendons at the shoulder. The rotator interval is responsible for keeping the biceps tendon in its correct location. Because the rotator interval is usually indistinguishable from the rotator cuff and capsule, lesions of the bicep tendon are usually accompanied by lesions of the rotator cuff. Move on to the cryokinetics. So, what is cryokinetics? Cryokinetics is a rehabilitation technique involving ice application followed by progressive active exercise. The benefits of cryokinetics include exercise, increased blood flow to the injured area, vital in healing once the initial acute phase has passed and any bleeding has stopped. Cryokinetics re-stabilizes neuromuscular function and is possibly much earlier than normal, and as such as atrophy or wasting of the muscle has not had time to set in. Swelling is reduced dramatically through the combination of cooling and exercise.